Math 365. Myself Srija. Today you are going to learn about the ICD-10 coding classification for the diseases of the integumentary system. So in this session you will be learning about the chapter 12 ICD-10 code classification for the diseases of the skin and subcutaneous tissue. So what does this chapter contain? This chapter contains the diagnosis codes that are used to classify the diseases of the skin. So what are the purpose of these codes? So these codes, they help healthcare professionals to document skin related conditions accurately, to plan and monitor treatment, to support the medical billing and also the reimbursement. So it also facilitates the clinical research and statistics. So skin diseases are extremely common and cover a wide range of conditions such as the infections, dermatitis and eczema, urticaria, nothing but the hives, alopecia, nail disorders, and also the other inflammatory or structural skin conditions. So this chapter L00 to L99, it is divided into blocks based upon the type of skin disorder. So this slide, it highlights the following useful groups like L00 to L08. It describes about the infections of skin and subcutaneous tissue. Nothing but you will find the about impetigo, cellulitis, abscess, pharyngeals, carbuncles like disorders. So L10 to L14, it describes about the bullous disorders. L20 to L30 about dermatitis and eczema. L40 to L45 papillosquamous disorders. And L50 to L54 urticaria and erythema. And also L55 to L59, it describes about the radiation related skin disorders of skin and subcutaneous tissue. L60 to L75, it is about nail disorders, hair disorders and also the sweat gland diseases. And the last category L80 to L99, it describes about the other disorders of skin and subcutaneous tissue which are not classified in above the earlier sections. So these are used to classify about the skin disorders. So these codes, they help clinicians and medical coders to document and bill further skin related conditions or infections very easily. So coming to the first category L00 to L08 about the infections of the skin and subcutaneous tissue. So what does L00 describe? It is assigned for the staphylococcal scalded skin syndrome. So what do you mean by staphylococcal scalded skin syndrome? It is a severe blistering skin disease caused by the Staphylococcus aureus toxins. So skin appears peeling or red or raw, that is similar to the scalding from hot water. So it is very common in infants, also young children. For example, baby with a peeling skin. So which code you have to assign? You have to assign the code L00. Coming to L01, it is impetigo. So whenever impetigo is diagnosed in the report or in the clinical document, you have to assign code L01. So this is a superficial bacterial skin infection. It is caused by staphylococcus or streptococcus. So this produces the honey colored crust, nothing which are yellowish scabs. So this is common around the mouth and also nose, often in school age children. For example, L01.00 code we will assign for the impetigo unspecified. So child with crusted lesions around the mouth. So next coming to L02 code. This code is classified for the cutaneous abscess, pharyngeal and carbuncle. So these are the conditions which involve a localized pus collection under the skin due to infection. So what is abscess here? Pus pocket inside the skin. Whereas pharyngeal, it's an infection of hair follicle, and carbuncle, it's a cluster of several pharyngles. In the right side, you can clearly see the picture of the carbuncle and pharyngles. So this is the pharyngeal and this is the carbuncle. You can clearly see the formation of the pus over here. So next, you have to always identify the type of infection, but that is maybe it is a impetigo or abscess, etc. You have to check the location of the infection, whether it is a site specific code exists in L02. If documentation does not specify the site, you have to assign the unspecified code. So if physician mentions multiple abscesses on different sites, you have to assign multiple L02 codes. So the right side, you can clearly see the picture of the impetigo. The crusted lesions around the mouth. You can see the crusted lesions around the mouth shown here. So next coming to L03 category code. So what is L03? Cellulitis and acute lymphangitis. So what is cellulitis? It is an acute bacterial infection of the skin and subcutaneous tissue. So this spreads rapidly and commonly involves streptococcus or staphylococcus bacteria. So what are the characteristics of cellulitis? If the symptom is redness, you will find the inflammation due to infection. If the symptom is swelling, it is due to a fluid accumulation. If the symptom is warm, if nothing but the reason is increased blood flow. If there is a pain or tenderness, it results in tissue irritation. So what is the coding example for cellulitis? You have to code L03.115 for cellulitis of the right type. So clinical documentation, they should clearly state the side plus laterality. For example, you have to emphasize the cellulitis is not limited to the skin surface. Like it's an infection, it spreads deep into the tissues, making it serious if untreated. So how cellulitis affects the body? You can clearly see a picture over here. You can find the pain and tenderness around the affected skin area. You can find the redness. You can find the swelling in the affected skin area. You can find the swollen lymph nodes near the site of an infection. And also you can find the warmth around patches of the infected skin. So L04, it is acute lymphadenitis. So what do you mean by acute lymphadenitis? It's an acute infection of the lymph nodes. So this is often secondary to the bacterial infection from the surrounding tissue. So what is the example code? L04.0. You have to assign this for cervical lymphadenitis. Nothing but it's an infection of the lymph nodes in the neck region. So what are the signs? They include swollen, painful lymph nodes, fever, and also tenderness. So lymph nodes, they act as the filters of the body defense system, right? So when an infection spreads, the nodes become inflamed. So next coming to L05, pilonidal cyst. So what do you mean by pilonidal cyst? It's a fluid-filled sac with hair and also the debris located near the sacrococcygeal region. Nothing but top of the buttocks. It can become infected and form an abscess. You can clearly see a picture over here. So it is located at the top of the buttocks. So what is the coding example for pilonidal cyst? L05.01 for pilonidal cyst with abscess. So it indicates it has the active infection plus it also has the pus collection. So how it forms? Hair press friction, it leads to hair penetration, hair penetrates the skin and then it creates an inflammatory reaction and then it develops into a cyst, then infection and then abscess. So this is often seen in young adults, people with thick body hair and also prolonged sitting occupations, for example for drivers, office workers, etc. So next the code is L08. So why do you assign L08? For other local infections of the skin and subcutaneous tissue. So this category, they include the minor skin infections which are not classified under other codes. So what are the examples? Pyoderma, nothing but pyoderma is a pus forming infection. So dermatitis with infection. So when the chart clearly describes about the infection but it does not fit the cellulitis or abscess or cyst codes, you have to check L08 code. So this is about the cellulitis and pilonidal cyst. So next coming to the category codes L2, L10 to L14 which is assigned for the bullous disorders. So what are the bullous disorders? These are the skin diseases characterized by the blister formation. Blister is nothing but it's a bulla. So what is the code classification? L10 for pemphigus. So pemphigus, it's an autoimmune blistering disorder. So the immune system, it mistakenly attacks the proteins that hold the skin cells together. So what is the subcode L10.0? It is for pemphigus vulgaris. So it is caused by the antibodies against the desmosomes, cell-to-cell adhesion structures. So blisters are the facet, soft and easily rupture. You can clearly see the right side picture, the blister one, you can clearly see them. Those are flaccid, soft and easily rupture. So they affect the skin and mucous membrane, for example like mouth, throat, etc. So this blister forms within the epidermis region leading to the oozing, crusting and raw painful areas after the rupture. So whenever pemphigus vulgaris is diagnosed, you have to assign the code L10.0. So next coming to L12.0, it is pemphigoid. L12 is pemphigoid. So autoimmune disorders like pemphigus, they antibodies, they attack a different skin structure. So what is pemphigoid is different from pemphigus? The site of the blister type, and also the severity. For example, you have to assign the code L12.0 for bullous pemphigoid. So this is seen usually in the elderly patients. So tense blisters that do not rupture easily. So next, coming to the code range L20 to L30, which describes about the dermatitis and eczema. So what do you mean by the term dermatitis? It's an inflammation of the skin. And eczema, it's a type of dermatitis with itching, redness, and also the dryness. So what is the code L20? It is assigned for atopic dermatitis, nothing but eczema. So this is a chronic allergic inflammatory condition. So this is linked to genetics, allergens, and also the immune response. So whenever the flexural eczema is assigned, you have to give the code L20.82. So this appears in skin folds. For example, you can find them in near the elbow, near the neck, near the knee. So itchy rashes worsen with scratching or the allergens. So next, coming to the code L21, the seborrheic dermatitis. The seborrheic dermatitis, they affect the scalp, face, and also the oily regions. So random flaky white or yellowish scales, this leads to in itching. So what is dandruff? You have to assign code L21.0 for dandruff. So mild form affecting the scalp only. So here you can see the picture. In dermatitis, that you can find the defective skin barrier, you can find the penetration of the allergens, the immune system activation, and also the inflammation. So this results in a dry skin or itchy skin. So next, coming to the codes L22, it is for diaper dermatitis. So what do you mean by dermatitis and diaper dermatitis? This means it's an inflammation of the skin presenting with redness, itching, swelling, dryness, cracking, or blistering. So these codes, they classify different causes and also the patterns of the dermatitis. So what is the code L22? It is for diaper dermatitis. So what do you mean by diaper dermatitis? It is a rash occurring in the areas covered by a diaper. For example, for infants or elderly. So what is the cause of the diaper dermatitis? Prolonged moisture, friction, fungal overgrowth, or candida. So what is the appearance of this? Red irritated skin over buttocks or genital area. So which point is the key point here to assign the code for dermatitis? So you have to use L22 when the rash is clearly linked to the diaper use. So next, coming to the next category code L23 for allergic contact dermatitis. So what is the cause for the disease? It's an allergen exposure activates the immune system. So what are the symptoms? The redness, swelling, severe itching, sometimes blisters, etc. So what is the example? Whenever you find a rash after wearing metal jewelry like latex gloves, perfumes, hair dye, etc. So whenever this happens, you have to assign the code L23.4 for contact dermatitis due to chemicals. So this is used whenever the allergen trigger is chemically based. So next is L24, the irritant contact dermatitis. So what do you mean by irritant contact dermatitis? The skin irritation without the immune reaction. So these irritants, they damage the skin directly. For example, like soaps, detergents, acids, friction, etc. So in these cases, you have to assign the code L24.7 for irritant dermatitis due to cosmetics. This is used whenever the cosmetics like makeup, lotions, they cause the irritation. So next, coming to L25 codes. It is for contact dermatitis unspecified. So this code is used whenever the cause is unknown or not documented. So the symptoms, they match the dermatitis, but the trigger isn't identified. You have to use L25 only when the documentation lacks a clear cause. So next is L26 code for explorative dermatitis. Nothing but it's a general skin redness. So severe and widespread redness are scaling over 90% of body surface. They may be associated with the drugs, cancer, autoimmune disease. So other requires the emergency medical care. So this is about the L26 code. So what do you mean by L27 code? It is assigned for dermatitis due to the drugs. So what is the cause? Adverse reaction to the medication like oral, injectable, topical, etc. So this prevents as rash, blistering, peeling, itching. So L27.0. So this is for generalized drug-related skin eruption. So widespread rash across multiple body areas after the drug exposure. So you have to always check physician documenting conformly about the drug casualty. So this L28 is for the lichen simplex chronics. So what is the cause? Repeated scratching, thickened, and this often associated with the stress, anxiety, long-term itching disorders. So common areas for Tanuja is its ankles, neck, wrist, and genitals. So what are key clinical feature? It's a lichenification. So it is a thick, dry, hyperpigmented skin. So this is about the code L22, L28. So next coming to L29 classification. So what is L29 to L45? This codes, this section of ICD-10 codes, they include the skin disorders characterized by inflammation, itching, scaling, or papules or plaques. So what is L29? It is for pruritus, nothing but itching. So pruritus is a severe itching sensation of the skin. So L29.9, it is assigned for pruritus unspecified. So this is used whenever the exact location or exact cause of itching is not known. So what is the example? Generalized body itching without a clear diagnosis in the medical record. So then L30 for other dermatitis. So this category, they includes the type of dermatitis not covered in the other sections. For example, L30.0. L30.1, L30.2. So this L30.1, they describe about the dyshidrotic eczema, which appears in the vascular hand and foot dermatitis. So these are the small fluid-filled blisters or vesicles on palms and soles. So these are very itchy, often triggered by the stress, sweating, or allergies. So what is the example? A patient with itchy blisters on hands after sweating or stress. So coming to L40 to L45 code category disorders. These are the chronic inflammatory skin diseases. So these are caused by the scaly, that is squamous epithelium, and also raised like papular lesions. So what is psoriasis over here? Psoriasis, it's a chronic autoimmune skin disease. So how it is produced? This is done due to a rapid overproduction of the skin cells. So skin appears red, inflamed, thick and covered with silverly white scales with the person who is suffering from the psoriasis. So there are types of psoriasis. L40.0 for psoriasis vulgaris. This is the most common form, that is silvery scales over the red flakes. And the other psoriasis is a pustular psoriasis, which you have to assign the code L45.5. So this is the formation of the pus-filled blisters. So where the knot infection related. So the images on the slide, they tell you about the vulgar psoriasis, psoriatic erythroderma, guttate psoriasis, inverse psoriasis, and also the pustular psoriasis. For example, if a patient with thick scaly patches on the elbows or knees is diagnosed, so you have to assign the code from L29 to L30.1. So next coming to L41 code, it is para psoriasis. So what it is? It is a chronic inflammatory skin disorder. So lesions may resemble psoriasis, but they are thinner and less scaly. So these are usually long-standing and they are difficult to diagnose early. So what is important here? It is important to differentiate from the psoriasis and also from the lymphomas. So whenever a parapsoriasis is diagnosed within the patient record, you have to assign the code L41. So what is L43? It's a lichen planus. So it's an autoimmune inflammatory condition which is causing the purple polygonal itchy papules, and often it affects the wrist, ankles or oral mucosa. So this is all about today's session. In this session, you have learned about L00 to L43 code classification for the disease of the skin and subcutaneous tissue. So in the next session, you will be learning about the code classification from L45 to L99. Thank you.